welcome to the Reflection Show with me, Martha and Spice. Today, I have an amazing conversation with you, especially the females. So, if you're a woman, or you, of course, every man has either a wife, a sister, whatever, you have a woman figure in your life. You want to look at cervical cancer. It has been a big issue that a lot of us don't have information about because we are usually either scared or shy to talk about it. But this time, we want to open up about everything about cervical cancer because it's killing a lot of women or giving them so much complications. But we want to reduce the complications, if not stop the complications at all. Let's go for a breather. When we are back, we start the conversation. I am Martha Vice. Welcome back. Like I said earlier on, we'll be looking at cervical cancer. And I pray that you actually make time to listen or watch this episode. It will be on our YouTube channel and it will be available for all of us to watch at any time, apart from being on TV. I want to encourage all of you to watch. Don't say you are not a woman. Of course, you have a woman figure in your life, so make sure that they get this video. I'm here with two amazing doctors, Dr. Ruhia and Dr. Anita, who will be helping us to delve into that. So let me go straight to the point. Let me start with you. Cervical cancer. What is it all about?
Okay, so cervical cancer is a type of cancer that affects only females because it affects the cervix, which is the entrance to the womb. That's what we see locally, but it's the entrance to the uterus.
Okay.
That connects the uterus to the vagina. And so the cells of that area are prone to getting a certain kind of cancer, which is the cervical cancer. So that is basically what it is.
Now we see that we keep hearing about it. Why is it common, or how common is this?
Okay, so cervical cancer worldwide is the fourth most common cancer among women. And in Ghana is the second most common cancer among women.
Wow.
Second to breast cancer.
Breast cancer.
And usually in the years, from what our data has, about 3,000 women, are diagnosed with cervical cancer yearly.
In Ghana?
In Ghana. And
Wow.
out of that number, more than half of them will die. So it is a concern to us, and it should be a concern to everybody, because this is a kind of cancer that can easily be prevented. So if you have that kind of a cancer and it's killing so many women, we need to do something about it. We really need to do something about it.
Eesh. If like about 1,500 women have to die every year just because of that, then we're actually losing a lot of women because of looking at maternal mortality and other illness.
Yes.
Now, the risk factors. Who is at risk?
Well, the risk factors, first and foremost, I would like to say being a woman is the first risk factor, because it's only women who have cervix. If you don't have a cervix, you have no risk of getting it. Then aside having a cervix, the next most important risk factor is sexual activity. If you are not engaged in sexual activity, the risk of you getting it is very low, because it's usually caused by an organism that is sexually transmitted.
Okay.
So if you are a woman who has started sexual activity, then you have two risk factors already. Aside that, we have people who have started sexual activity quite earlier than others, being at more risk than those who started later. So early coitaki, that means early sexual activity, is something that also puts you at increased risk of getting cervical cancer. In addition to that, if you are someone who has multiple sexual partners, like I said, it's sexually transmitted. So if you have multiple sexual partners, then your chances of getting the organism that causes it is high, which means that your chances of
Especially
getting
with unprotected sex.
yes, so that's another risk factor. Unprotected sex is another risk factor. And also, if you are a woman who has given birth several number of times, there's a particular number you reach and we say you have become a multiparous woman. That means you've given birth quite a number of times. So the more you give birth, the more the changes in the cells occur. And that puts you at increased risk of getting the cancer. That's just among some of
it. So you said that it's in the cervix, and we know that we can't just go and see the cervix like that. How do I know? Well, not me. How does one know they have cervical cancer?
Okay, so cervical cancer, before it occurs, let's go back and the organism we're talking about is called the human papilloma virus. It's a virus.
Human papilloma virus.
So
that's what causes cervical cancer.
95% of cervical cancer. So it's abbreviated as HPV. Now HPV, because it's sexually transmitted, most women would develop would get the infection once they start having sex. But if you are normal, you don't have any other problems, your body should be able to clear the infection in a vast majority of people so that it doesn't stay. But in a few people, in a low percentage, the virus remains in the cells. So when it remains in the cells, it has a very long time before it starts causing changes in the cells. So for cervical cancer, before you start getting symptoms, you might have had the HPV for a very long time. Most of the symptoms will start to show when the disease is advanced. But when you have it for like early stage diseases, usually you don't have any symptoms. That is the difficult part of it. Because if you had early symptoms, you seek treatment early. But usually the symptoms will start coming when the disease is advanced. And by that time, sometimes the treatment is difficult. So some of the advanced symptoms are that sometimes the woman would a woman who is having her menses, she realized that she starts to bleed in between her menses. It's not time for her to have a menses, but she's bleeding. And the bleeding is not like her usual menses. It will come and it will stop. It will come and it will stop. Or she realized
that's a symptom when you are having like bleeding in between
your menses.
Yes. That can be a symptom.
That can be a symptom. Or that you bleed after you've had sex. You realize that anytime you have sex, you have some bleeding. It's called contact bleeding because by that time there have been changes to the cervix. So when there's any little contact to that cervix, you will bleed. So you have some bleeding after sex. Sometimes you have very offensive vaginal discharge. Sometimes with a little blood in it. Okay. Then if you have finished, like you are menopausal, you might still start bleeding again, what we call postmenopausal bleeding, which is not normal. Sometimes you would have that when you urinate, you feel pain. You feel some pelvic pain, like pain in your lower part of your abdomen. You feel some vaginal discomfort.
Hey, the pain, is it different from the one that, there are times that when it takes a long time before you go and wee, then after you finish wee, you feel it's this pain that lasts for like sometimes even up to a minute, then it goes?
Okay, so with pain from urination, this pain, sometimes you feel the pain when you want to urinate. You feel the pain when you are urinating. You feel the pain after. You understand? And it's something that seems to be constant all the time. Then you feel like you have some pain in your pelvis. And then you feel pressure. And sometimes when you have sex, you feel pain. But those are all advanced because when it's in the early stage, it is what we call asymptomatic. There are no symptoms unless you are being screened, and then it can be found out early.
Wow. Yes. How is there a way that, so you mentioned one way that if it's not at the advanced stage, the HPV can be in you, then maybe your immune system in a way can just fight it and it will go back. But is the advanced stage that you are at risk of these symptoms that you have mentioned?
What she is saying is that usually when you get the virus that causes the infection, you are likely not to have any symptoms because naturally your immune system should be able to clear it without any help from a doctor or any medication. But in some people, the immune system is not able to clear the virus, so it stays in your body for long. All this while you still don't get symptoms.
Mm.
You walk about normally, doing your activities normally, as if nothing is wrong with you.
Mm.
And as it stays in your body for long, the cells within which they are living start changing gradually.
Mm.
And then with time, it can change to become the cancer.
Mm.
So initially, when the virus is within you, there is no cancer.
Okay.
It's just an infection.
Okay.
And there are no symptoms.
Okay.
Then as it changes, it becomes the cancer.
Mm.
In the early stages of the cancer too, there are no symptoms.
Okay.
But as the cancer worsens, that's when you start getting the symptoms she's
Okay.
mentioning.
Okay.
So by the time you are seeing maybe the blood coming after your menses or after your menopause or the discharge, most likely it might have moved to other parts of your body. It's no longer just within your cervix. It might have even gone into your uterus or have gone to your vagina or other parts of your body. That's when you start seeing the symptoms. By that time, even if there is some form of treatment we can do for you, it may not be able to help you that much.
Wow. So how can that be treated? Is it even treatable? Okay.
For treatment, it is. But then it depends on the stage at which we get to know that you have it.
Okay.
So if it is in the early stages, like we said, the chances of you getting well from treatment is very high. But then as it advances to the more dangerous stages, the chances of the treatment helping you are not so good. So there are various kinds of treatments. We have surgery for some forms.
Okay.
We have radiotherapy, which means that we are going to give you some rays, something like the way we do x-rays, something similar. It's not the same thing, but something similar to kill the cancerous cells. Or they give you some medications, which we call chemotherapy, to help kill the cancerous cells. But before treatment, the first and most important thing is to make sure that you don't even get it. Prevent yourself from getting it, because prevention, they say, is better than cure.
Okay, so landing on that, let's look at the prevention measures. Okay.
So with the prevention, because we said that 95% of it is caused by the HPV, which is sexually transmitted, there we need to prevent people from getting the HPV infection in the first place. That is the basic prevention for us. So sexually transmitted infections, how do we prevent them? By having safe sexual practices. So that's the first one for us. So if you can delay your first sexual encounter as late as possible, if you're going to start, you should have protected sex. And then if you you have a child who is younger, like from 9 years, we have a vaccine against the HPV virus.
Wow.
Yes, there are vaccines that help you prevent you from getting the virus, and it's been found to be very effective. But because of late, we realize that people are starting to have sex earlier and earlier and earlier. You want to give it before the person starts to have sex.
Okay.
So the vaccine, you want to give it from boys and girls 9 years, from 9 years to 26 years.
Wow.
You understand? There's a vaccine.
I can just imagine a mother being able to carry the 9-year-old girl to the hospital, and so be just wow. It could be very but I've never heard it has a vaccine.
Yes, there's a vaccine for the HPV virus. It is not, that's why we are on this campaign. It is not so widespread. There's a lot of ignorance about this disease. There's a vaccine available to girls and boys. That can prevent cervical cancer and other forms of cancer, because HPV causes, apart from cervical cancer, it causes a lot of other cancers and some other diseases. This vaccine has been found to help in about 80% prevent all those things.
Wow.
So the only challenge is the availability of the vaccines to us
and accessibility
in sub-Saharan Africa. Do you understand? It is there, but if we can advocate for it to maybe the cost to come down, for it to be,
because it's very expensive.
It is quite expensive. Made available for a lot of people. In future years, there is the possibility of eradicating disease that's caused by HPV. Do you understand? So those are some of the things. So we want to educate boys and girls, parents, the general public, that apart from other sexually transmitted infections, that when you can get symptoms very early and then you go to the hospital. This is one of them. You don't get the symptoms, but the consequences are sometimes far worse than most of the sexually transmitted infections we have around.
Mm.
So prevention, immunization. And then when you do the immunization, we also, as one form of prevention, we want to screen.
Okay.
Because as we said, it takes a long time for the HPV to develop into cancer. Before it develops into cancer, it develops into something we call pre-malignant lesions or pre-cancer, a pre-cancer condition.
Yeah.
You understand? So the screening we are screening is to catch it. So maybe we missed you, you didn't get the vaccine, you haven't maybe be able to practice safe sexual practice, you've had HPV, you don't know. The screening will help us to, one, detect if you have HPV.
How is the screening done?
So the screening, there are various methods of screening. For screening for cervical cancer, we are screening not for the cancer. We're not screening for the cancer. We're screening for the condition before cancer, so that we treat it. Because once you get the cancer, you get symptoms. At that point, it's not screening. At that point, we are confirming and treating. So the screening is that you come to the hospital. You are not having symptoms. That's why it's screening. You're not having symptoms. You come to the hospital. We do what we call a pelvic exam. That means we position the woman. We look at your cervix with a special instrument. There are different kinds of screening that we can do. One of it is that you use a long instrument. You just take a little bit of the cells, because the problem is in the cells of the cervix, and then they look at it under the microscope to see that whether there's any problem. If there's no problem, we schedule you for another screening. Usually it's every 3 years for a woman who doesn't have any problem. Every 3 years you come and we take the cells, we look at it. If it's fine,
that just like a swap.
It's a swap.
Okay.
And we always like to start from 25 years, because we assume that mostly by 25 years a woman would have become sexually active. Then we start the screening every 3 years. You come for the screening. That's called the pap smear. There's another screening where that one you will position you. We look at the cervix and we apply a solution to the cervix, and then wait to see whether there are any changes in the cervix. If we see any changes, any color changes in the cervix, usually if there's you have the facilities available, you can take what we call a biopsy for us to see whether there's any problem, or you can treat. You can treat it as a pre-malignant lesion, because sometimes when women come to the hospital, that's the first time you see them, they never come back. So it will be a missed opportunity to screen a woman to see that there are some lesions on the cervix. If I can do something about it, why don't I do something about it right now? Rather than letting her go, then I don't see her again, and maybe in future it develops. So that one is called the visual inspection with acetic acid, because you are just looking at it, you are applying some acid to it. The acid doesn't burn, it just and then you look at it, and then you treat if there's anything. Then there is the other one that tests for the HPV itself. So you are checking the cells to see whether the HPV DNA is there. If it is not there and the cells are fine, that test, you do it every 5 years.
Okay.
You get it? Because the HPV stays for a long time before it changes. So if you test and you don't have HPV, even if you get HPV today, it will take more than 5 to 10 years before it will develop into anything.
Okay.
So I want you to come back for me to test you in 5 years again. But if I'm testing you without the HPV, I don't know whether you have it or not.
Yeah.
Your cells are fine. You come back in 3 years and then we test you. We do that till you are 65 years.
Okay.
If you get 65 years and you've had 2 tests, consecutive tests that have been normal, then you can stop screening.
Hey, this thing, the screening and the stuff. Anyways, I believe that it's something that every woman should look at when it comes to general health screening. It's not something you should, let me say, joke about it, because even if you are safe, your neighbor might not be safe. Let's go for a break. Welcome back. We're still looking at cervical cancer. It's an issue in a lot of women, and I'm just disheartened to know that over 3,000 women are diagnosed every year, and over half of that number can die or lose their lives because it gets into the worst state. We all need to be able to understand that we need to take our health seriously. I think in Ghana, unless you're really sick or something is really affecting you, we don't. Is it also because the doctor to patient ratio is not very high? So even when you go cry, I met sometimes when they go to the hospitals and yours is not, so they'll be like, oh wait, somebody is dying. let's save the person. You there, you are healthy, and you will now want to come for checkup. So let me come back to you on some of the prevention measures. Let's go take it one by one and look at how we can prevent ourselves from cervical cancer.
Okay. So when we talk about the prevention, let's say, of all diseases in general, we usually tackle them in three main stages. The first stage is primary prevention, which means that you don't even want the risk factor to come into play to cause the disease. So if we are looking at cervical cancer, the first step is to practice the safe sex techniques we mentioned. First and foremost, you would want to abstain, because we've mentioned that about 90% or more of the cervical cancer cases we see are from the infection, which is sexually transmitted.
Has there ever been an issue worldwide where you meet someone who is not sexually active or have never had sex and has cervical cancer?
Yes, there are in medicine, there are always cases like that.
Okay.
But they are of the minority.
Okay.
So our focus is on what we can do to change, because in those cases, you really can't do much about it. If the patient has some special condition, because there are some special kind of cases that they have the risk of having the cervical cancer due to other conditions they have.
Okay.
But they are of the minority. We are talking about 95%. If we know that in cancers, most of the time, there are so many different. We've identified one thing that if we can eliminate this, we can reduce the incidence of cancer by almost 80%.
That's true.
So that is where all the focus, and you can prevent it.
That's true.
So yes.
Yeah, so let's come back to the prevention.
Yes. So first and foremost, we advise that young women who are not up to the age where they can start the screening should abstain from sex. Abstinence is the first advice we'd give. If you are able to abstain till the right age, fine. If not, as you've started sexual activity, you should want to take precautions to make sure that you don't get any sexual transmitted illness. We all have been hearing about condoms, the use of condoms. You can protect yourself.
Yeah.
Have protected sex. If you have protected sex, it reduces your chances of getting this infection. And if the chances of the infection goes down, that means that your chances of the cancer goes down significantly as well. Then aside that, if you have started and you have not been able to practice protected sex, then the next thing to do is to make sure that you screen yourself regularly.
Okay.
That's the second stage of the prevention. So the first two I mentioned are under the first stage. You don't want the risk factors, but you've not been able to prevent the risk factors. You've gotten the risk factors. Now you want to make sure that the second stage, you catch whatever is going to lead to the disease in the early stage. So like she mentioned, when the changes are occurring, it doesn't just go to cancer straightforward. It changes to pre-cancer, which is very, very benign, which means that it's not that harmful. It can be treated. So in that stage, if we are able to screen and pick it up, the chances of sending it away completely are very high. So if you have started sexual activity, you have not protected yourself, you know that these two are very good risk factors of getting the disease. Start screening frequently. 3 years if it is the pap smear, 5 yearly if it is the HPV, or any other method of screening. Your health attendant will let you know how frequently you should screen. So aside screening, if you, let's say you are unlucky, either you've been screening, we didn't catch it early, or you have not been screening, you are just walking around, your sexual activity is ongoing, you are not screening, it has not been caught, it went past the pre-cancerous stage to the cancerous stage. You have started seeing the symptoms and you've come to the hospital. We've confirmed that you have the cancer. The third stage of prevention is the treatment. Once you start seeing any abnormalities within yourself, you start seeing that you have discharge, or maybe your menses, you are now bleeding in between,
Yeah.
You were no longer bleeding. Let's say you have started menopause and then you start seeing blood again. Don't wait for long before you go to the hospital. Get to see a health worker early enough so that we can pick it up early and then treat it. So the third stage is early diagnosis and treatment. Once you notice any change within your body, go to a hospital, get to a health worker, let
Yeah.
them see you, examine you, screen you properly, diagnose you and treat
Yeah.
you early enough to prevent any complications from
Okay.
coming in.
Now, is cervical cancer different from fistula?
Yes, it is very, very different. You can develop a fistula. A fistula just means that it's a connection, an abnormal connection between two organs, basically, two whole organs. You can develop a fistula when you get cervical cancer because the cells that you are not normal cells, they are sick cells. And the cervix and the bladder are very close. So if the cells are dying and they go up into the bladder and they go and die, they create a hole in the bladder. Then you have a hole between the bladder and the vagina. So you develop a fistula, which you have urine leaking from your vagina continuously. That is because the complication of the disease is the fistula that has formed.
My head is becoming big. Like that can happen?
Yes.
Yes.
Wow.
And then from treatment of the disease too, you can develop a fistula. But usually that is so advanced. That's like the stage 4 of the disease to have developed it. That means that it has moved from your cervix and it has gotten into your bladder.
All this wahala for women. Women, we are always suffering everything. So it means that if care is not taken, you can actually have cervical cancer and fistula
Yes.
at the same time. But it's like it's more. I'm not deviating. I'll come back. But it's like it's more in higher risk for, at women who give birth. I mean, with fistula.
So that's a different kind of thing. That's called an obstetric fistula.
Hey.
During delivery, you can have some injuries that would you would develop a fistula. That has nothing to do with you having cervical cancer. It's just the process of the delivery. Your delivery didn't go well. It wasn't maybe attended to very well.
Okay.
And so you had the baby cause some trauma between either your vagina or your cervix and your bladder. And then you develop the fistula. That is
stubborn babies. Come on, you are causing. Wow.
Separate from it.
Okay, I think we have to get another day and do a whole education on fistula because I'm getting scared already. Yeah, so on cervical cancer, I don't want to say is it transferable or is it, so we've understood that by it's a form of STI kind of where you can get the HPV, but is it where because maybe your mother had it, you can also get it? Is it something like that? Yes.
Not really.
Okay.
Not really, because it's an infection. You know, infections it depends on your environment where you are and your practices. So the fact that it's not one of those cancers that is considered to be hereditary. There are some cancers that run in families, but cervical cancer actually is not one of them, unless the family has similar practices.
Okay.
Because you know there are some practices that would expose you to developing a sexually transmitted infection. Let's say that they are the family has this child marriage, they agree to child marriage and things, it runs through their family. That means if you marry off a young child, she's married, so she will definitely so she already starts to have the risk factor. And most of the time they are married to somebody who has
their grandfathers
wives.
Otherwise.
So not just you having multiple sexual partners, your partner having multiple sexual partners puts you at risk. So maybe you have one.
That's
partner,
just the person. But
that partner has others. It puts you at risk. So that is those kind of social circumstances can put families at risk, but not genetics. In this case, cervical cancer, not genetics.
Wow, we've established that early sex can cause that. Now, when you see people in very rural communities, you see that as they, I don't know how to put it, but people tend to play with their private parts during sexual activities. people get to finger each other. Even parents, or let me say, who want to show like beat up their girls, sometimes want to put kakadro and things in their private part to show that they are disciplining them. Are they all risk factors?
There are some particular cells that it survives in.
Mm.
So with the fingers, maybe oral,
Okay.
oral sex, yes.
Mhm.
But if your fingers are clean, you wash and then you put foreign objects in, which is not something that we
It's encouraged.
encourage
Yeah.
at all. But it is not a known risk. As at now, it hasn't
Okay.
been seen that those
Okay.
things predispose you. It can predispose you to have other things.
Mm.
Because if you're putting things that are not supposed to be there, they could be caustic. They could cause the vagina to close up. They could cause the patient to have laceration. They cause the patient to bleed. Those are different things that are separate from risk factors for cervical cancer. Even though we do not encourage those kind of things, but it hasn't been found.
Yeah. So now, how do we help people? Most of the times, we look at the family. People think that it's a curse, or it's out of witchcraft, or you went and took someone's husband, or you went and killed someone's child, so the gods are now angry with you. That's why you have. How do we open up our minds, or even help other people to open up their minds that it is not spiritual?
Okay.
I believe you've had those encounters.
Yes.
So how can that be handled?
So, like every other condition we diagnose medically, cervical cancer is diagnosed medically. It is not associated to any spiritual or religious illness. Like we said, it has a known cause,
Okay.
a virus. Once you get the virus, the likelihood of you getting it is high. Not everyone with the virus gets it though, but then the likelihood of you getting it when you have the virus is higher. It is not something that you go and snatch somebody's husband that it will happen to you. If you've snatched someone's husband, or you've offended someone by marrying the husband, it's probably because you had multiple sexual partners, or the husband you took had multiple sexual partners and has been able to transmit the infection to you. That is why you have it, not because you have done something wrong. It is something that is solely medically diagnosed and treated. It has nothing to do with spiritual or religious issues. It's nothing like that. It's a treatable illness. It's something that can be prevented at the best. So first and foremost, let's prevent it. Let's not stigmatize those who have got it. Let's encourage our women to screen regularly for it, and they will not even get it to talk of treatment.
Okay.
Also, people like you can help us, because we've noticed that it's sometimes some of these diseases are attributed to spiritual and religious things out of ignorance. Because if I cannot explain what is happening to me, I have to find an explanation. And then the explanation might just be in my environment. My culture will say, okay, they say if you do this, you get this. So maybe that is what is happening to me. So we are trying to get people in the media, we're trying to get people in schools to explain to them. When you understand what is happening to you, you will not attribute it to something else.
Yeah.
So we're trying to education is key in this sense, because when you know what is happening, you know where to seek for help.
Yeah.
So our first thing is education. Once you can educate, especially people in schools, if you can educate the girl child to take control of what's happening with her body,
That's true.
she knows that, okay, sex, if I have sex, these are some of the consequences. I can get pregnant, I can get this. If I get it, that means that I should do this. It is not the gods that are cursing me. It is just that I have done it. I didn't do it the way I was supposed to do, but I can seek help, so that I don't coil back into my corner. I wait, because I'm afraid to go and talk about it. I don't even have anybody to talk about it.
Yeah.
Maybe when I tell my mother or I tell my grandmother, she'll get angry with me. When we have safe spaces for women to talk about these issues, it disabuses their mind. It helps more women to come forward. If you have ambassadors, people who have had it, have been treated, have been cured, go around and they tell people about it, then they know that, okay, I know this woman. She had it. She went to hospital. She's fine now. Let me also go. But if everyone is treated, they are fine, they stay at home, they keep it to themselves, then it's difficult.
You're afraid of stigma.
Yes. It is difficult. Then nobody wants to talk about it. So we need to talk about it. It's talking about it, showing people where to go, showing people the outcomes, the success stories after they have been treated. That is the only way we can help. We can help, and making health accessible. Honestly, when you don't have, if you don't even have a health center in the community, and their only source of care is maybe a spiritual healer or somebody who deals with maybe herbal medication, which we are not discouraging.
Yeah.
But if that's the only source of medical care to them, then before they would come to the hospital, it would have been too advanced.
Yeah.
So trying to make medical care as accessible as possible is one of the ways we can help. Because once you start bleeding and you come to the hospital, definitely you will have to be treated.
That's true.
Or if I know that every 3 years when I go, I have access to being screened over there, nobody says anything, I will go. But if I know that I have to travel, everybody has to come to the teaching hospital for it to be done, and I don't have
because
transport,
sometimes it's like
I won't go.
It's like breast cancer. So we know that January is for cervical cancer. We wait October breast cancer. It's after the whole noise is made, we now go back to our shelf. How can we continuously continue this education?
So for the education, it will be healthcare. Funny enough, most healthcare workers are available to talk to people in their vicinity. The problem is that if there's no healthcare worker there, you have to move me there. But you can't move me there every day. Maybe I live in Tamale and I have to go overseas. I can't go there continuously. So what we advocate is that you don't need to be a health worker to be able to educate people on some of the conditions. You can identify key stakeholders in the communities. You do a training for them. They are living in the communities with the people. It is a continuous thing. Every time he or she can give a talk, can talk to the students. Then maybe when the big month that has been attached to the disease or whatever condition, then you can have reinforcements. People come and then remind them, maybe make a bigger deba. But it has to be continuous.
Yeah.
Because you can't wait 1 month out of the year to do it. Look at the effect it has on
and
people.
Even that 1 month, you can't even attend to even 10% of women in Tamale.
That is the truth.
Putting together all the hospitals, it will not be possible. So at the end of the day, how are we? So you've mentioned now the health professionals. Sometimes some of you are not also helping in this education. It's like some of you have selected certain, I know everybody and their specialty, but if I'm coming to ask you and you don't have more knowledge on certain things, I believe you can refer me to her. But some will say that, oh, that this one is not that common. Like I've had people who tell you that, oh, let's forget about this topic and talk about that topic. For example, you mentioned educating the young people about the effects of teenage pregnancy. I have never heard, or let me say, I can't remember hearing all of us involved going to the schools and doing education on teenage pregnancy and mentioning some of the effects that can be cervical cancer. So it's like it is not in the ears of the young people. People hear cervical cancer and it's strange to them. And we feel that it's far away from us. All we talk about is teenage pregnancy, dropouts from school, and those basic things. But I believe if we lay it bare to them, looking at the medical consequences, that can also scare them and that can reduce some of these things.
Well, like she said, if we don't all take it as something that is of concern to us, and we leave it to a particular group of people, let's say those who are medically experts in that area, it is something that will not carry across very good. I know for sure, since we started this campaign over a few years now, we've been reaching out to schools. Last year, if I remember correctly, we met some comfort girls to talk about it. They had a lot of questions linking it to HIV/AIDS, to teenage pregnancy and the likes. They were very happy to have us and they were excited that we were available to attend to them and answer their questions and expel some of their misconceptions. So it is something that we can carry across only if we see it to be of concern to all of us. If we, those who are involved in educating them about teenage pregnancy, gain this knowledge as well. Whenever we are giving out the knowledge on teenage pregnancy, we shouldn't forget to add those things, because we all know about HIV and other STIs, and we've been communicating it to them. Now, there are a lot of teenage girls who know that HIV is something you can easily get from sexual activity. But then they don't know about cervical cancer. They don't know about human papillomavirus. So
even coronavirus has more fans than cervical cancer. It just came recently.
If we all take it as something that is of importance to us and add it to all the education we are giving to the young girls out there, it's something that will go across very well.
Okay. I want us to go for a break. And when we come back, I want us to delve in how to get access to health professionals. Some of you want to come for education in schools. I mean, you want us to always pay you. Yes, some of us have some of these experiences though. Let's go for a break. Stay tuned. Welcome back. We are still looking at cervical cancer, and then we're just trying to understand how we can all put our hands together to solve the situation. Now, we don't have a lot of time. I want us to look at how. So if somebody has, let's say, a child group, a women's group at a school, and wants access to nurses, are you available to do these educations? Is the Ghana Health Service available to support with some of these educations in these youth groups I've mentioned?
Okay, so the thing is that when you want to have education for a group, it depends on the topic you want to talk about, because Ghana Health Service does have a health promotion unit. Okay, so if you contact them, and they would give you a schedule. But let me talk about the teaching hospital, because that's where we are, which is under the Ministry of Health. We have a public health unit. So if you have a particular thing you want to talk about in schools and you want health professionals, you can come and see them, and then they would help you as how to go about it. Maybe they have focus persons. For us right now, for cervical cancer, it has been adopted by what we have the Medical Women's Association of Ghana. Okay. Which is made up of all the female doctors in Ghana. Wow. So what it does is that if you have any, and there are certain things that are very peculiar to women that we are trying to champion in terms of health. So if you have a school or a group of women, or no, it doesn't even have to be women, people you want to talk about, something that we can help you with, that's true, you can just reach out. We have a branch now in almost every region. Okay. And so in the teaching hospital, you just reach out to the chairperson or the president, you give out your proposal, and then we will make arrangements. Sometimes it doesn't even have to come from the teaching hospital. Depending on where you are, we'll just link up with whichever medical person is in that vicinity to help you out. So that, and we are willing to do it. And usually it's not at a charge. Okay. You understand? It is because it is part of our business. You are hearing them. It is not at a charge for, as of now, Medical Women Association, we don't charge people for coming to educate people. Because if I educate you and you can prevent, that's making my work less. Because you will not come to the hospital with the complications, and I'll have less patients to attend to. You get more time to rest. You understand? Yeah, so we would encourage people who want us to come and help them talk about some of these health. You reach out to us, and we are ever ready and available. So we hear it's expensive. How expensive is it to screen? To screen. So it depends. There are different kinds of screening, as I told you. So the visual inspection, that is for low-income countries, because it is, I won't say readily available, but it's the easiest of them. It is around 50 Ghana cedis per woman for that one. Okay. The one that you come and we just apply that and how about the swab? The swab is a pap test. So after we take the swab, a pathologist has to look at it. So that was a little more expensive. That's about around 200 cedis. But as things are changing, the cost might be changing. Right? And then lesser or higher? Definitely higher, not lesser. And then the HPV is the most expensive one. The last I checked, it was about 350 Ghana cedis, because that they do the pap smear. So it's two tests. They do the pap smear, which is, let's say, 200 cedis, and then the HPV test, that was about 150 Ghana cedis. So, but that is things might have changed, but those are the steps. So if you want to do, if you're doing the HPV, you test every 5 years. So if you do 350 for every 5 years, or you do 200 for every 3 years, or you do 50 Ghana cedis, maybe that one to every 3 years, it is not as sensitive as in it can be the acetic acid can miss certain things, but the likelihood is not that high, and it is more available to a lot of women. Looking at the economic situation, yes, and you can walk into most facilities and tell them that I want to screen for cervical cancer. You can, so whatever is available to that facility, they will tell you.
Okay.
If they don't have it available, they can direct you to where
you
can get it done.
Okay.
And then depending on what is available, it is done for you.
Okay. So what are the, let me come with conclusions. What are the most important things that you have to tell everyone watching us today to know about cervical cancer?
Well, the most important thing is that cervical cancer is common, more common than we think it is. And it is something that we can easily prevent only if we take precautions. So let's take the necessary precautions we mentioned. Avoid the risk factors. If you cannot avoid them, screen regularly. Let us detect it early enough and help you treat it.
Okay.
That's basically it. But for me, I was screening. Come for this. We don't have a national policy yet.
Okay.
Like, vaccination, we have we are vaccinating children against certain diseases. HPV is not yet part. We don't even have a national policy as to when it's time for, maybe you did your HPV and you did your screening 3 years ago. It's time. And I'm sending you a reminder, madam, please, you have to come for it. We don't have that yet. But you can walk in and then make a conscious of it is your health. Take responsibility for it until we can have it in a more organized. So screen. We're available all the time. Please come for screen.
And you said the vaccine you mentioned is not in Ghana yet.
It is in Ghana. It is in Ghana, but it is not widely available. So currently you can only get that vaccine in Kumasi and Accra. It's not in Tamale.
Wow.
Yes.
So by in Tamale, TTH, Central Hospital, like all the hospitals in Tamale, anyone can walk in to have a cervical cancer screening.
So you can go and inquire. I'm not sure about all the other hospitals. I can only speak for our facility.
Okay.
But yes, our facility, you can walk in anytime. You come to the maternity building, ask any of the nurses or any of the security men, they will direct you. And then you have a conversation. They'll tell you the options. You choose one and then you are.
So how much is it at TTH?
So those are the
so prices
for the
you've
TTH,
given.
the visual inspection is 50 Ghana as of today, 50 Ghana cedis, and then for the pap smear it was about 200 Ghana cedis.
Oh, okay. So it means that when you are going, just carry 500 Ghana cedis and go. If you get change, then you know that you have change. If not, but I think it's important that all of us should make a conscious effort to get tested. Get screened, to get screened for cervical cancer, because you might never really know at what points that you might be at risk. Don't wait till it gets to the point where you can't come out, you can't wear clothes because you have to be in a certain position because you have cervical cancer. I have been speaking with Dr. Ruhia and Dr. Anita, all at the Tamale Teaching Hospital here in Tamale, educating us on cervical cancer. Let's not joke about this. Throughout the year, go and get tested. We might not have been able to answer all your questions out there, but I believe with the brief information that you have, the most important thing is that do well and get tested. If you are married, let your wife get tested if she hasn't tested. If you have some girlfriend somewhere, let her get tested. Or you yourself as a woman that you know you are sexually active, please get screened. Please, I'm using tested, and I hope you understand. I'm not a medical person because we've been talking about issues on HIV and stuff, so I'm using tested, but I mean go and get screened. And then now the internet is widely available. Google, go on YouTube and get to learn more about cervical cancer so that you would be safe, your family will be safe, and you also have the right information to educate young people out there. And to people in the media, I also want to encourage all of us to do well once in a while to advocate for these things. One time, hopefully, we'll come and talk about prostate cancer. We are not leaving the men out, and hopefully breast cancer. We want to take our time to explore some of all the dimensions on health to make sure that we stay strong and alive. I am Martha Inspires. I'll be back with thoughts. welcome to Thoughts from Matter Inspires. We just finished talking about cervical cancer, and one of the highlights for me is the fact that a lot of us are having sex younger. Who taught us that? How did we arrive at that? Unfortunately, let me say our parents have gone out of control with us because sometimes we say we know things our parents do not know. I want to ask you a personal question. Are you sure that the mistakes you are making now will not affect your children? There are times we are like, oh, maybe our parents made certain mistakes, so we are suffering from the mistakes our parents made. But are you sure that the mistakes you are making now won't affect your children? You are 16, 17, 15, 14. What? I know, of course, it's normal. The hormones are boiling and all of that. But if you have to have sex with someone, make sure you have the opportunity to have safe sex. Make sure you are taking responsibility for your actions and you can face the consequences. Cervical cancer is no joke. It is taking more lives than expected. Today, I want to encourage every woman listening to me, every young girl listening to me. The men always have the escape routes. You live with the consequences. Make sure that whatever you are doing with someone's son, with your boyfriend, with any male figure, it's not going to affect you alone. So the next time you want to have sex, make sure you are doing it safely. The next time you want to go to the hospital and check yourself of your heart and your liver, don't forget to screen for cervical cancer. Let's not leave that out because when it strikes, it might be too late for us to prevent it. Thank you for watching this episode. I am Martha Inspires. Do have a good night.